We've all given aspirin and acetaminophen suppositories to our patients before, but did you know that you can give many other traditionally oral medications rectally? There are many reasons patients can't swallow pills, and in these cases, rectal administration can be a literal lifesaver. Rectal administration of medication and hydration was actually really common in the past before IV therapy was widely available, and it worked because the rectum has a huge capillary network that quickly absorbs all kinds of substances. In the distal and mid-rectum, capillary beds go into the iliac system, and more proximally, they drain into the portal venous system. Who cares? Well, you should, because supply chain issues are only going to get worse. The world is constantly plagued by catastrophes, and we have no idea what supplies we're going to run out of all of a sudden. And there's always going to be patients who can't take oral medications because of strokes or oral lesions or refusal or intractable vomiting. If you don't have an injectable medication, how can you help them? It pays to know how to improvise before you're forced to. The great news is that most oral drugs can be given rectally. And I'm not just talking about suppositories here, I'm talking about oral tablets that you crush and insert into the rectum. The two major exceptions are sustained release drug preparations, so for example, certain beta blockers and calcium channel blockers, and also drugs that are notorious for causing severe gastritis or esophagitis, like concentrated potassium or bisphosphonates or iron. If you have doubts, do a quick online search to see if it's ever been done before in case reports, or if you have a pharmacist on staff, ask them. They can be helpful. Any patient with healthy rectal anatomy is a good candidate for rectal administration of drugs, but probably not patients with unhealthy rectums. Use plain common sense here. Once you have an appropriate medication for an appropriate patient, just put the pills in a pill crusher and grind them up. Pour the powder in a medication cup and add maybe 5, maybe 10 mLs of water and stir. Then once it's all dissolved, draw it up into a 10 cc syringe. Don't use too much water, just enough to dissolve the pills. Add a generous dab of lube. If you're just administering a single medication one time, you can use an angiocatheter for that dose. If a patient is going to need more than one dose of a medication or needs hydration, you can use a Foley catheter. Insert the catheter till the balloon is past the internal anal sphincter, just a few centimeters in most patients, and gently inflate the balloon. Then take the syringe with your dissolved medication and flush it into the Foley and into the patient's rectum. Follow it up with maybe another 5 to 10 mLs of water tops, just to get all the medication in there. Then plug the Foley so things don't leak back out and let it sit. Depending on the volume of stool in the patient's rectum, the medication should be absorbed fairly quickly. Using low volumes of liquid is important here because that means the drug is more concentrated, which means it is absorbed more rapidly by the patient. You can use a similar method to hydrate patients rectally. You can use safe drinking water or even oral rehydration solution if you have that. It's best to administer small amounts every 15 minutes or so, and various sources say patients can absorb 200, even 400 mLs of water per hour this way. If you give too much liquid, you'll probably overwhelm the patient's capacity to absorb it, and you'll get a kind of messy enema result. Also remember that fluids and electrolytes will always equilibrate with the patient's serum values, so hypotonic solutions will hydrate the patient, isotonic solutions won't do much, and hypertonic solutions will dehydrate them. Sometimes patients have cultural hang-ups about rectal administration of medications, and sometimes they don't. You might have to take your time and explain it to them. Your biggest pushback might be from nurses or administrators who just aren't familiar with this technique and think it is gross and icky. Often you can get around nursing discomfort by offering to administer the medication yourself. You can also easily find plenty of case reports online to show staff, patients, and family that there is ample precedent for what you're doing. Yes, rectal medications may be a little unfamiliar and a little scary, but there's a whole lot to learn. Look into it a little. But if you decide to try it, just remember it's like Saturday night. Get consent before you go there.